Well, here at Houston Birth and Baby, we have birth and postpartum doulas, and they operate a little bit differently. Doulas in general provide emotional, physical, and educational support to expectant, laboring, and postpartum families. Although they are trained professionals, they're not medical caregivers, so we don't have the ability to give medication or make any medical decisions for you or your family. On the birth side of things, doulas are known for increasing your confidence, increasing your comfort in labor and pregnancy for that matter. We help support you through your pregnancy, through your labor, through your birth, and we take an active role in helping you create a birth plan. A birth plan is what you and your partner, if you are partnered, put down on paper that discusses and navigates your fears, your concerns, your expectations, and your preferences. So we as doulas help guide you to ask the right questions, to receive the right resources, and to seek this kind of support that you need in regards to your experience as a growing family. Most doulas make themselves available via the phone through the course of your partnership, and that's so you can address any questions or worries that might arise. And on our team, we work in pairs. So you've got two doulas that you are developing a relationship with in order to pick their brain and ask questions and kind of get a really solid support system in place. And then when it comes to delivery, only one of them comes to your birth, so you have an extra set of fresh hands and fresh eyes if your primary doula needs to take a break or step away for whatever reason. So during delivery, a doula's main goal is to assist you in providing safe and positive birth experiences. So we're in constant close proximity to you, and we contribute to relaxation and pain relief techniques through breathing exercises, through different laboring positions, through different touch techniques. We help you visualize things. We assist in creating a calm environment. We are really, really great at reading the room. And then after the birth, immediately after, many of us are able to help with the transitory work, which is, the cleanup if you're having a home birth, the physical recovery, the breastfeeding initiation if that's how you choose to feed your baby, family bonding, and basic newborn care. On the postpartum side of things, the needs of the family, the unique needs of the family, are really where we shine as postpartum doulas. We aid in the emotional and physical recovery post-birth. We aid in breastfeeding support if that's how you choose to feed your baby. We assist with newborn care, such as bathing, feeding, comforting. We do light housekeeping and meal preparation. Sometimes we run errands for you, pick up the groceries on our way to your house. We can provide sibling support and care for older kiddos that are in the house. We're really, really great at baby soothing techniques. So if you're familiar with the 5 S's, we are experts at that. We are great at providing you with referrals to local and trusted resources if we see some red flags popping up around your postpartum mental health. And again, this service varies by need, the different needs of the families that we work with. So for some families, we are only supporting them for a few days while they get their feet underneath them. And for other families, we provide continued support for several weeks or even months. This can be during the daytime, it can be once a week, it can be overnight, it can be several times throughout the week. It's really, really unique to each individual family. All of this work helps you transition into a more confident and solid parenting plan. So the benefits of doulas are really, really varied depending on which type of doula you're looking for, but generally across the board, doula support, we help provide emotional support by being a cheerleader, because we all need a cheerleader when we do hard things. Sometimes you'll need a maternal voice of compassion or nurturing. Occasionally you might need some tough love. We're great at that as well. That firm love pulls you through those challenges that might be presenting themselves. We do all these things. We reduce your anxiety and your fear and help instill strength and confidence in your parenting abilities. Physically, there's a lot of benefits to doula support. There's been many studies done that have demonstrated the benefits of having a doula present during labor. So a common theme of positive birth outcomes is, women or families are less likely to need pain relief medications. The use of synthetic oxytocin or Pitocin is decreased by 40% when you use a doula. Requests for epidurals are decreased by 60% with the support of a doula. And some other studies have even shown that having a doula as part of the birthing team decreases the likelihood of unexpected cesarean sections by 28% and the length of labor by 25%. So throughout these studies, the best results really occur when the expecting family receives continuous labor support from a doula rather than like a hospital staff member or someone from their personal lives. That's just simply because we don't have an emotional connection or attachment to the client, so we're able to be a really unbiased third-party presence to really speak to what's happening and give you some clear-headed decision-making abilities. We provide information. So do you need all the facts and figures to kind of wrap your head around the big changes that are happening in pregnancy and postpartum? We got you. We translate all the medical jargon and help you make educated and informed decisions from a place of calm and detached emotions. So how do we support the entire family? We don't support just pregnant people. We support partners and dads as well. We don't take the place of the birthing partner, but instead we provide tools and reassurances to encourage their participation. And this significantly strengthens the partner's role in a very intimate experience that expands your family. Doulas offer strategies to the father or the partner to engage in the birthing process, such as suggesting, like comfort techniques. And we instill confidence that they too can experience a beautiful, beautiful birth through participating in this way. After all, your partner knows you emotionally and intimately, and we as doulas know birth and the intimacies and intricacies that happen in a labor journey. Together, we provide safe, calm, and pleasurable experiences for everyone. For siblings, we support siblings too. Becoming an older sibling is challenging in a lot of ways. So we work with you and your bigs to educate them on how awesome being a sibling is, and we help you navigate the challenges that come along with parenting a newborn and an older child. We do this a couple different ways. So we offer a sibling class where we really sit down and teach your big kids how to care for a baby, and we talk about some big emotions and big changes that might be happening in their life and kind of give them some tools to navigate that. Another thing that we do is we offer sibling doula support, which is caring for the big kids during your actual birth. So our unique knowledge surrounding birth helps us translate for the kiddos what's happening so that it's normalized for them and they understand that, their parents aren't actually in excruciating pain. It's a part of labor, it's a part of birth, and it's bringing the baby into the world. This can actually help you as a laboring person by easing your mind so that you know that your kiddos are cared for and they're not afraid of what's happening and they are aware of what's going on. And we're really, really happy to offer this kind of service. And we do this by introducing ourselves prenatally. We do a couple of visits before the baby's even born for you guys, the parents, to kind of go out and have a night on the town, have a little reconnection date time, and we just play with the kiddos and talk to them and get to know them and introduce what role we play in the birth. And for the grandparents, we support them too. The modern grandparent is just as important as ever, and in many cases more so than ever before. The world's changed and evolved and over the years, so have the recommendations for safety and health of caring for children. So we help grandparents understand these changes so they're an amazing support system for you when you navigate parenthood. How do we support single parents? That's another clientele base that we work with. We know birth, and so we wholeheartedly support all of the decisions that you make, and we unequivocally step in and be the voice of compassion and encouragement that you need while providing physical assistance and information so that you can make decisions for you and your child that are completely unbiased without any emotional attachment. And we're a really solid sounding board for you, because when it comes down to it, we know birth, and we want to make sure that you have all the information that you need to have a really, really successful birth or a happy birth experience. So when it comes to choosing doulas, how do you know that you're choosing the right doula for you? So let me talk about some questions to ask and some questions that you can ask, but they're not really going to get you the answers that you want. So number one, training. You want to know what a doula's training look like. There's no current formal degree program or universally recognized credential for doulas, but there are many trusted certification programs that doulas can choose to attend and obtain a certificate of completion. Typically, a birth doula has to finish a minimum of 7 to 12 hours of childbirth education. That's not for themselves. They have to actually participate in a childbirth education class and get a feel for it from a client's perspective. They often have to attend at least 16 hours of an actual birth doula training, which can happen, consecutively over a couple of days or a few days per week. And they often have to attend 2 to 5 births. So additionally, those who plan to provide postpartum services will go on and receive additional education around postpartum support, usually like 27 or so hours of postpartum doula education, and they need to assist at least 2 families with postpartum support prior to their certification. All of the doulas on our team at Houston Birth and Baby are highly trained and certified or pursuing certification. Another thing you can ask is, you want to ask about their passion and their heart work. Like, why did you decide to become a doula? And that will give you a really great insight into the person that you're working with. So if your potential doula is acting in the role of a birth support person, they've been a support person for many people in their own lives. This isn't just something that we wake up and decide to do one day. We've been the role that we've played in our life is usually like, the mom friend or the best babysitter, or we're the friend that when you have a bad day, we just know what to say. It's kind of an innate skill or an intuitiveness that we have gathered and always carried around with us. So asking your potential doula what brought you to doula work really gives you a glimpse into their passion for this work and who they are as a person, which is really, really important because you want to connect with your doula. This is someone who's going to be joining you through some very, very intimate moments of your life and supporting you potentially through some really, really hard and challenging moments as a new parent. So when it comes to experience, you may not want to ask how many births have you attended, because that's not going to tell you anything about their passion or their hard work or their innate skill set. That's just going to give you a set number. But what you should ask is, what type of support have you given the people in your life? And that goes back to the passion and the hard work. That really, really gives you an idea of if this is the type of person that's going to be able to support you through some challenging moments. So the training that your potential doula has received is essentially bookwork or knowledge around the standard unfolding of a labor progression and how to enhance that standard labor progression happening. Their experience has been developing over a lifetime of supporting friends and family through difficult and challenging situations. So your potential doula might be childless, but they're the most amazing doula. They may not have attended a birth yet, but they've supported friends or family as they prepare for or participate in marathons or weight loss or serious grief or major relationship challenges or even health scares. They are doulas. So if you're interested in learning some more about our particular services and the packages that we offer, I would love to chat with you about it. I am Erin Young. I'm the owner of Houston Birth and Baby, and we've got 7 doulas on our team. We have both birth support doulas and postpartum support doulas, and we work with you in any any birth setting. There we go. Hospitals, home births, birth centers, we attend all of those. On the postpartum side, we offer daytime support, we offer overnight support, we offer sibling support, we offer childbirth education. So if you want just a little bit of knowledge around what to expect in labor, we got you. If you want a little bit of education around breastfeeding, we can help. If you want a little bit of education around what a cesarean looks like, we can help you figure that out. If you are wanting to know how to prepare for an induction or a scheduled cesarean, we can help you with that as well. Childbirth education is something that I'm very passionate about, and I'm happy to discuss these things with you. We also offer placenta processing, and we offer infant feeding support, which is not necessarily lactation support. It's more about discovering the ideal feeding plan or solution for your family. And we work with you for the entire first year, developing that and continuing helping you evolve as those plans change. We also offer massage therapy. So give us a ring, drop us an email, send us a message, and we'd be happy to schedule a consultation with you to answer any further questions that you might have and meet our doulas. As far as COVID-19 protocols go, we know that it's impossible to eliminate all the possible risks, pre-pandemic included. But with our standards and protocols in place, we are able to support you. So not every labor and delivery is allowing support people to attend births right now, but some of them are. So if you're curious, give us a call and we can figure out if your place of birth is allowing doulas to be physical support. And if we're not allowed to physically be there, we are able to provide virtual support, which looks like a lot of this, a lot of Zoom calls, a lot of virtual meetings, a lot of phone support, a lot of email support, a lot of virtual socially distanced sit-down meetings that we can really hash out and talk about the challenges that you might be experiencing. And when it comes to birth, we can support you at home before you transfer to the hospital using the safety protocols that we've put in place. And what that looks like is our doulas check their temperatures daily. They know any symptoms of illness. If there's a fever or a sign of illness, they let me know and we reschedule the shift or have the backup doula step in. Remember, we work in teams so that we can always have a healthy, symptom-free doula available for our clients. Our doulas don't work with families directly if they have had or been exposed to COVID-19, with the understanding that once they've been through their quarantine period, without symptoms, they're able to start working with them again. Families who have been in contact or diagnosed with COVID-19 will be offered alternative virtual support like this, or we will just reschedule the particular shift in question until symptom-free for 2 weeks. Families are asked to sign a release of liability in addition to the standard contract that we have. This waiver addresses the preventative measures and intensified sanitation protocols that we have intended to put in place to reduce the spread of COVID-19. Doulas will provide their own personal protection equipment, including a change of clothing upon entering the home, their own hand sanitizer, gloves when needed and request, and masks upon request when in close contact with families for the entirety of the shift if the family prefers. At this time, we're only scheduling one postpartum doula per family, so our postpartum doula hours are limited, and we do not do more than 35 hours a week so that our doulas can have time with their own dedicated families. Doulas are not assigned to work with more than one family at a time, and they follow proper health guidelines when they're out in the community not working with doula clients. Families will continue to have flexibility in scheduling hours with weekly billing, and we also accept HSA and flex spending accounts to cover the cost of our services, and we're always open to family and friends buying gift certificates and providing services for you that way. So that is my nutshell presentation on meeting the doulas of Houston Birth and Baby. And as I mentioned earlier, due to technical difficulties, we were having a lot of trouble getting us all in one spot tonight. So if you are interested in meeting any of our doulas, please reach out and let me know, and we will schedule a consultation for you. I hope everyone is healthy and well and having a wonderful evening, and I will talk with you all very, very soon. Good night.